This season is called Building a Borderless Career in the PhD in Public Health series. Hi, you're welcome to the Remote Woman Africa podcast. So, for context, I'm Olive. I'm a mom. I've worked in the banking sector and in the financial sector for a very long time. And now I made a drastic move. Poop to healthcare. Yes, because drastic measures call for drastic times, or drastic times call for drastic measures. Not me get English. So now I am trying to move from bedside to understanding systems, right? Like from treating symptoms to understanding systems. So let's get right into it. For over a year now, I've been seeing patients one at a time, but something felt very uncomfortable. They kept coming back sick, same illness, same preventable symptoms, same structural problem, but something struck. That situation that caused this illness remained untouched. Could it be it? We have been treating the wrong things. What if, just what if, we start to tackle or start to prevent what really caused these sicknesses? I don't get it. I've cracked the code. I started to ask questions. I began to make researches, and that's when I found public health that focuses on the whole population instead of just one patient, and ask questions like, why is there high mortality rate in certain regions? Why is this certain disease spreading so fast in certain communities? Why do policy failure create health crisis? Instead of waiting for patients to show up at the hospital, why not let's work at the upstream, where we, first of all, prevent them from even falling sick in the first place? It felt like sitting back and seeing the entire map instead of just one road. I'm not going to mince words. Living and working in Nigeria, I've seen how infrastructure gaps affect healthcare outcomes. Now, when compared to healthcare systems in countries like Canada, you begin to see how infrastructure influences survival. Listen, healthcare is not just medicine. It's funding, it's policy, it's data, it's planning. And I've realized I do not in any form, way, or manner want to work harder in a broken system. No, I gotta make that thing. I want to be able to understand how to build better outcomes. That's why I choose public health. And one of the very sweet things about this public health is that it's not confined just in the hospital, because if you see how I hate confinement, God, and there are remote research roles. Global NGOs hire from diverse roles, right? And then data analysis can be done from anywhere. You can even leverage on platforms like LinkedIn that has made global connection very possible. So to me, this PGD is not just academic, it is strategic. You get to the point here now. And as a mom, and at the level I am right now, I don't have the luxury of drifting through career decisions. But every move I make right now has to give me a leverage. Let me explain it to you. You see, the public health I'm doing right now is giving me intellectual leverage. Remote systems is giving me geographic leverage. And then, guess what? Sharing my journey publicly is giving me the visibility leverage. I'm becoming a very badass strategist. So, ladies and gentlemen, take this podcast as my documentation of transition from the finance industry to healthcare to a global public health professional and strategist. Wouldn't you rather clap for me? If you're a healthcare worker thinking bigger, if you're an African woman building beyond the salary, if you believe that your career should not be limited by geography, this series is for you. Welcome to your journey, and